Hello, good evening. My name is Dr. Chudi Ufondu of Snowspirations Global Health Solutions. Thank you and welcome to our evening clinic. Today's clinic is going to focus on breast lumps and breast changes. If you recently noticed a lump in your breast, if you recently noticed some changes in your breast, either both breasts or one of your breasts, should you be worried? What are the things you should be on the lookout for? What are the steps and the guidelines you can apply so you can be at peace? What's the clinical implication of noticing a breast lump? Is that breast lump a sign of cancer? Is it commoner? When should you get worried? If you have a daughter, probably a teenager, who suddenly noticed a lump, or if you notice that the nipple is inverted, or if you notice that the color of the breast is changing, if you notice that your breast is producing milk when you are not pregnant, if you notice that the body of the breast is feeling like an orange, what are the significance of all this? If probably in course of shaving your armpits, you notice you have some swelling in the armpit, which is probably painful. At the same time, you noticed that your breast is heavy and you notice pain. What are the implications of all this? So these are the things we're going to talk about this evening. Very important for so many reasons. Every lady in our clinic today should be conversant with the breast. Breast self-examination is something you should know, something you should teach your girls as early as possible. Disease conditions of the breast develop over time. They are not acute. So breast cancer doesn't develop overnight. There are certain things that will happen, and it might be a sign or a warning that you might likely be predisposed to developing cancer. So please, when you join, I need to know your name. I need to know your location. And once we have a good number, I'm going to start. I'm going to present my clinic this evening. Then afterwards, you'll have an opportunity to ask your questions. Today is the last day of October anyway. And October has been very rewarding. I hope you were able to accomplish your objectives. And I hope you can be grateful. I hope you can be thankful. It's possible you didn't really finish everything you planned to accomplish in October, and you're wondering, oh, you failed. No, you didn't fail. You are still standing. So be thankful and plan ahead. So let's get started. Once you come in, make yourself comfortable so we can start. We don't really have much time. I'm planning to spend about 20 minutes. So here's the deal. All forms of lumps, all forms of pain, all forms of discovery, changes in the breast must be fully investigated. Fully. So if suddenly you notice that you have this nagging pain in your breast and it's not related to your period, there are some times in your cycle you will experience breast pain. When the hormones in your body are switching, when they are changing roles, when your reproductive hormones are fluctuating, estrogen is going up or coming down, progesterone is going up or coming down, prolactin is going up or coming down, your thyroid hormones, your follicular stimulating hormone, your luteinizing hormone, anytime they are fluctuating, they can present in the breast. Now, your breast is made up of so many tissues. Your breast is made up of water. Your breast is made up of muscles. Your breast is made up of fibrous tissues. And all these sometimes can interplay. So the reason why you might have lump might simply be because of hormonal changes, accumulation of fluid, or inflammation. And once all those stuff resolve, you will feel better. So if you notice any pain during your bleeding, during your ovulation, and once you stop bleeding, that pain stops, it's not a pain you should worry about. It's likely a pain that is related to your period. So some women can have what we call premenstrual syndrome. prior to your period coming up, you will start developing some symptoms. Breast tenderness is in that category. So breast tenderness is a situation where in course of touching the breast, you will feel pain. But please, if you are within your reproductive phase of life, you should be conversant on how to examine your breast by yourself. Make it a point of duty to be observant. The two breasts cannot be equal. One would definitely be bigger or taller than the other one. It's expected. But please, any morning you are taking your bath, have a big mirror you can use to observe your breast. Very important. Check the color, check the appearance. Some women will suddenly notice that the nipple that used to be pointed out is inverted. That's a danger sign. Some women will suddenly notice that the surface of the breast is reddish. Some women will notice that their breast is producing some milk, and sometimes it can be blood-stained. That's a sign of inflammation. That might be a sign of infection, and sometimes it can also be a sign you have cancer. Now, if you know how to examine your breast, you should consider the breast like a clock. So the middle, it's where you have your minute hand and your long hand, right? Now you consider the top as your 12 o'clock. You consider the down as your 6 o'clock. You consider your 9, you consider your 3. So divide your breast into 4 quadrants. The left breast into 4 quadrants, the right breast into 4 quadrants. Then please use the palm of your hand to place it in your middle part of the breast and push it and gently feel how it is. Then go on different quadrants. So upper quadrant, upper outer quadrant, upper inner quadrant, lower outer quadrant, lower inner quadrant, then the center. That's how to examine your breast. Then you also examine the armpit. The breast develops from the armpit through the tail of Spence. So these are the things you should be conversant with. So if in course of examining yourself, you discover you have breast lump, and that lump is painful, there are certain times that when you have pain, that pain will be protective. There are some women that might have painless lump, and that painless lump might be a sign of cancer. There are some women that will have painful lump, and the painful lump might just be a sign of inflammation or infection, which once we treat, we're going to be okay. Now, it's not left for you to know if it's cancer or not. Your duty is to report to your doctor immediately. So evaluation of all breast lumps is a must. Any changes in the breast you noticed over time must be fully investigated. You must consult with your gynecologist immediately. You must be conversant with observing the power of the changes in your breast. Once you notice anything different in your breast, be it both breast or one breast, please report to your doctor. Now, it's understandable that the first thing that will come to your mind when you have a lump and pain is cancer. Thankfully, most times, the lumps we can experience in the breast, especially for younger women, are not cancer. Cancer is commoner among older elderly women. Younger women that have cancer, majority of them will have what we call fibroadenoma. They are non-cancerous growth. But all cancer growths, all lumps in the breast must be fully investigated. So it's important to evaluate all breast lumps. Now, how does the breast feel generally? A normal breast. How will a normal breast feel? Your breast contains different tissues, fats, glands, and connective tissues. Some breast-related lumps, some breast-related pains like tenderness, lumpiness, and changes are related to your cycle. Don't worry about them. Now, when the lump or the pain or the tenderness persists after your period has stopped, after you have stopped your ovulation, that's when we'll begin to worry. Some women will present with nipple changes. Suddenly your nipple is itchy, your nipple is reddish, and some women will notice inverted nipple. Listen to me carefully. Inverted nipple is a danger sign. Most likely you might have cancer beneath the skin. If you notice that the body of your breast is now feeling like orange, those dimpling, those spotted dimpling, and it feels so heavy, is a danger sign. So if you notice any of the things I'm going to mention now, please begin immediately to go to your doctor. If you notice a new lump or a thickening that feels like the surrounding tissues of the breast are matted together, your breast is no longer freely moving, report to your doctor. If you notice a change in the size, the shape, or appearance of your breast, that means prior to now you should be conversant of how your breast is. Report to your doctor. If you notice any pain that will not go away when your period is done, when you're done with ovulation, report to your doctor. If you notice that the skin of the breast, it's now itchy, is reddish, is scaling up, is dimpling, is puckering, that might be a sign you might have danger signs of some cancers. If you notice that your nipple suddenly goes inwards, your nipple is not supposed to go inwards. If you were born with inverted nipple, we understand that. We can operate on that. We can convert it back to the normal, position. But if you notice that a pointed nipple suddenly started pointing back, that's a danger sign. If you notice nipple discharge, thankfully, majority of the nipple discharge you will have might be due to increase in your prolactin, which if it happens in a woman that is not pregnant, it might be a sign you need to go and get treated so that your prolactin level can come back to normal and your fertility will improve. So what do you expect during your clinical exam? We're gonna look at your breast. So during this investigation, we're gonna take a critical look at your breast. We're gonna make sure that it's not cancer. We're gonna make sure it's not benign. So examination of your breast simply means we're gonna palpate. So we're gonna touch the breast. We're gonna feel the breast. We're gonna check for a couple of things. We're gonna check your armpit for the nodes, for the inflammation. Then we're gonna examine the skin of the breast. We're gonna check and see if your breast is discharging milk when you're not pregnant. When you're pregnant, your breast is supposed to discharge milk. So these are the things we have to do. Now, there are some specific investigations we have to run anytime we discover any lump in the breast. That lump must be fully investigated. Especially, we have to remove that lump and send it to the lab. There are a couple of procedures we can use to investigate the lump. We can do what we call fine needle aspiration or core needle biopsy or stereostatic breast biopsy. So biopsy simply means we're going to collect sample from the breast, then we send it for investigations to rule out whether it's cancer or not. There are some investigations we can also use to rule out the particular reason why your breast is having problem. We can do screening mammogram or diagnostic mammogram. Mammogram is just a spectral X-ray of checking the breast tissues. We can also do breast ultrasound. We can do breast MRI. We can do breast biopsy. So biopsy simply means collecting the sample and sending it to pathology to make sure everything is okay. So the essence of doing all this biopsy, ultrasound, MRI, mammogram is to discover what the problem is. So the outcome will tell us if this breast condition is something we should be worried about. Unfortunately, there are some women we need to remove their breast. So if we notice that that lump is cancerous, we will immediately plan what we call mastectomy. Mastectomy is the surgical removal of your breast, the entire breast. There are some types of mastectomy we call radical mastectomy. In radical mastectomy, we're going to remove your breast. We're going to remove the anterior muscles of that particular place that the breast is resting. We're going to go to your armpit. We're going to clear the lymph nodes all in your armpit. The essence of doing this is to save your life, because the problem with breast cancer, when it starts, before you blink, it will go to the other breast. So it has some connection, it has some drainages, it has some lymphatic tissue, some blood connections. So when cancer begins in one part of the breast, it can easily go to the other breast, then it can spread to the whole body. So once we discover cancer on time, cancer is preventable if it's discovered on time. We can completely remove the two breasts and save you. But if it's discovered late, once it has gone beyond one breast, once it has gone beyond the breast, a condition we call metastasis, you are a ticking time bomb. We can start you on surgery, we can start you on chemotherapy, we can start you on radiotherapy, but you don't have much time. So the key word is to be preventative minded. Let's prevent development of cancer before it develops. Anytime we have something we can prevent, it's always better to start from preventative perspective. So all breast lumps must be fully investigated. If you have a young girl who has started her bleeding, please help her to understand the power of observation. Observation is very important. So if you wake up tomorrow morning while you're taking your bath, put your two hands on your waist like akimbo, raise your shoulder a little bit, look yourself up in the mirror, see if your breast is symmetrical. One is going to be bigger than the other. Observe what can you see on the breast. Check the skin of the breast. Make sure it's not scaling up. Make sure it's not itchy. Make sure it's not reddish. Then gently palpate your breast on the 4 quadrants. Remember, consider your breast like a wall clock. Consider 12 o'clock, 6 o'clock, 3 o'clock, 9 o'clock. Check all the quadrants. If you notice anything that is abnormal, ring your doctor. Now, the reason why I chose this topic, a woman came to my inbox and complained that her 17-year-old daughter developed a lump, and she wanted me to tell her if it's cancer or not. I cannot tell you that. For us to know whether it's cancer or not, you need to take this young girl to a gynecologist, and we need to run investigation. We need to do what we call excisional biopsy. We open, we remove all the contents of that lump, then we send it to the lab, and if need be, if we have to cut off the 2 breasts, we have to do that. You are better alive with no breast than to die with your 2 breasts. I recently had a patient that came to my inbox. She was so freaking out about losing her breast. And I told her, do you really want to die, or do you want to stay around with a diseased breast? Once you have an opportunity to live, always choose life. So take your health serious. I'm not really impressed only 3 people showed up for this clinic. Matter of fact, this is more important than becoming pregnant, because you have to be around. You have to be healthy to become pregnant. Unfortunately, we are so selective. We only go for topics that will give us multiple pregnancy. Do you know that the possibility you might have breast cancer and you can have quadruplets and triplets is there, and before you blink, you will die and leave your babies behind? So let's always focus on preventative topics. Right now, I'm going to open the clinic, and I'll give you an opportunity to ask your questions. So please start asking your questions. I can see Tosin. I can see Yahaya Chiroma, one of my students, then COO. So guys, please start asking your questions. Let's use the next 3 minutes to ask questions. Immediately after this particular topic, I'm going to have a repeat topic of this same nature in Facebook. So if you're in our Facebook, please hop in. But right now, please ask your questions. COO, please go ahead and ask your questions. We're going to round up on top of the hour. That's in the next 3 minutes. So if you have any questions, please feel free to ask before we go. And that reminds me, today we launched a special, condensed, concise, educative, easy to use course on female fertility, on female infertility. So if you have a diagnosis of female factor infertility, so that means any of these pathways is diseased, go to that link, click on it, buy the course. Now, it's possible you've completed your family. It's possible you're not keen on starting your family. But this is a course that I would recommend for all women. Let me tell you why. All my experience as a provider in maternal and child health, I poured all my energy into developing that course. You might not develop female factor fertility today. It might be tomorrow. Like I can see Tosin. Tosi wants to have another baby in 2025, correct? Tosi, you're a candidate that should go and get that course. And when you get that course, please tell your friends to go and get the course. This is like your Bible. This is like your handbook. When you know better, you can act better. So it's a 15 model course. 15. Very important. Okay? All right. When should a woman begin getting her yearly mammogram? So it depends on your individual history and the location where you live. Now, in America, depending on the state, depending on your family history, most providers will want you to start having this around your mid-40s. But if you have a family history of cancer, if your mom had cancer, your sister had cancer, or there is any form of cancer in your family, we might start you early. Now, different states and different cities and different locations and different doctors might differ. There are some doctors that might want you to start having your mammogram as early as 40s. There are some doctors that might delay you having your mammogram up to mid-40s, or there are some doctors that will want you to start doing around 50s. So the frequency or when to start or when to stop is dependent on your own medical history. So when you go for your well woman check, have conversations with your doctor, find out what's obtainable in your own situation. The frequency or the need for mammogram is going to be based on your own individual history. So I'm sure in New York, they have different approaches. So there is no one size fits all in all these things. So it's based on regional differences in what they want. I love that question. Please keep asking your questions if you have any. My time is actually up, but I'm going to give additional 2 minutes. I can see some new people enter the clinic. If you have any questions on breast lumps, on health concerns, on likelihood of cancer, or likelihood of benign growth, please, this is your opportunity. Go ahead and ask your question in the next 2 minutes. Anybody? Okay. CEO, thank you so much. It looks like you're the only person that came prepared for tonight's class. But thank you, guys. Share this video with anyone out there. This might be a saving grace. It's possible you might be having lump now. You didn't even know. So when you wake up tomorrow, please go and check your breast. If you notice anything abnormal, report to your doctor. Don't panic. Don't panic. Trust me, don't panic. Don't get anxious. Don't develop anxiety. The earlier we detect the problem, the better. So when you wake up tomorrow, check your breast. If you notice anything you don't like, if you notice anything different, report to your doctor. The earlier we get started, the better. So thank you so much for coming. My next clinic will be on Saturday. Remember that my clinics are Tuesdays and Saturdays. So Saturday is going to be 3:30 p.m. Eastern time. Remember that this coming weekend, people in America will lose 1 hour. So be very cognizant of all those time differences. But if you haven't subscribed to this channel, please click on the subscription, set your notifications to tell you when I will come live. Then my next clinic will be on Saturday, 3:30 p.m. Eastern time, US. Thank you so much for coming. What about discharge from the breast? Any cancer concerns? It depends on the nature of the discharge. So if your discharge is blood change or it's discharging pus, then we're a little bit worried. But if you're discharging pure milk, then it's possible it's related to a condition we call galacturia, which can be a sign your prolactin level might be high, and of which the biggest concern in your prolactin level being high is the inability to have a baby. Because your prolactin level, when it goes high, it will affect the other reproductive hormones, so your ability to ovulate will be affected. So it depends on the nature of the discharge. It depends on the other symptoms. So if we have a lump, if we have pain, then if we have an inverted nipple, then if we have a breast that feels like an orange, you have cancer. If we dig in deeper, we'll see cancer there. It's the cancer inside the breast that is changing the whole nature of the breast. So be worried for the right reasons, okay? Eventually, a woman discovers swelling in the armpit, but the breast looks normal. What should the woman do? Of course, you need to report to your doctor immediately. Remember that the breast develops from the armpit, the tail of Spence. So any changes, any swelling, any enlarged lymph nodes in the armpit might be a signal you might have a problem in the breast, because the armpit contains the lymphatic tissues, the blood vessels, and everything that drains the breast. So if there is any problem in the armpit, it might be an indication you might have some breast problems. So yes, you have to report back to your gynecologist. Okay? All right. Good evening. You noticed a lump on your left breast after your birth of your child, and they referred you for mammogram, which you did. Your breast was examined. The biopsy result was negative. That's the right thing to do. Now, during pregnancy, majority of women will have differences in their breast, and they might start freaking out as if they have breast. The good thing is we remove the lump. We send it to the lab, and it's negative. So during pregnancy, definitely a lot of women will notice certain things that will feel like lump. But you did the right thing, Tosin, by going to your doctor, and we've certified you okay. So what you should start doing, which I'm sure you've been doing, is to make sure you go for your yearly well woman check. And if you notice anything, report to your doctor immediately. Okay? All right. Do we have any other question? All right. Thank you so much. If you still have a moment, please join me in Facebook in the next 5 minutes. We'll continue the conversation there. Until I see you guys, God bless you and enjoy the rest of your evening. And as you're getting ready to enter your November, let November be 30 days of blessings. Reclaim your blessings in November. Don't allow 30 days of November be in vain. So I encourage you to go above and beyond. Once you enter November 1st tomorrow, change your approach. Seek help. Attend master classes. Get your subscription. Get that course. Get that fertility. Get that female infertility management course. It will help you. Trust me. It's a course you need to go and feel the contents. It was well structured. I had to take time to develop all the videos, and it's still a work in progress. I'm still adding to the course. This is about the best you can get. So if you're hearing my voice right now and you've been wondering, oh, how can you get across to Dr. Chudi? That particular course will give you an opportunity to know exactly what to do. So Tosi, I expect you to go and get a copy of that course, and other women out there, make sure you get your copy. I'll see you guys on Facebook. Thank you so much, and bye-bye.